Welcome, everyone, to this special event on unlocking a healthier heart with Transcendental Meditation, or short TM. We're looking forward to an insightful session with Guy-Paul Gagné, MD, on the remarkable benefits TM offers for your heart and longevity. Dr. Gagné, a renowned medical expert, will explore the pioneering research behind TM and discuss why it's a reliable solution for enhancing our cardiovascular health and why its practice is something you may want to consider for learning for yourself. You'll also tonight have the opportunity to learn more about Transcendental Meditation, a meditation practice that is scientifically proven to lower blood pressure significantly and reduce the risk of heart attack, stroke, and even cancer. And for those who are new to Transcendental Meditation, it is an effortless, evidence-based meditation practice that is taught one-on-one by a certified TM teacher. And at the heart of TM is actually the powerful experience of transcending, inherent in its name, which describes and is really the experience of a journey beyond the active thinking mind to the most subtle depths of our own awareness. From this inward experience of transcending comes an unparalleled life-enhancing set of benefits, including our heart health. So at the end of today's talk, you'll have the opportunity to learn how to start your TM journey if you're interested by attending a complimentary preparatory session with a certified TM teacher. Now, to start us off today, Dr. Gagné will explore some of the groundbreaking science that sets TM apart as a meditation technique shown to significantly impact cardiovascular health. He'll also explore the possibility of TM bolstering our DNA and immune cells, leading to enhanced immunity and improved health overall. So there are a lot more we'll all learn tonight about the benefits and how it connects to our heart health. So what we'll do is we'll start the session with a presentation by Dr. Gagné and then open it up to you, to your questions during our live Q&A. And before we dive in, I'd like to introduce you to Dr. Guy-Paul Gagné. And Dr. Guy-Paul, wonderful to be with you. Let me just take a minute to introduce you to everyone. So Dr. Gagné is a medical doctor and former assistant professor in the Faculty of Medicine at McGill University in Montreal. He is also and has been a prolific speaker on maternity care and the scientific research on TM, including its application in education and stress management. And on top of all of that, he has 30 years of experience in clinical practice, teaching, and research. So warm welcome to you, Dr. Guy-Paul Gagné. And to start our session, it would be wonderful actually to hear your personal interest in exploring the connection between TM and heart health. What started this journey for you yourself?
Yes, thank you very much, Anna-Marie. It's very nice to have this opportunity to present the scientific research on TM. But my journey started a long time ago, at the end of the 70s, when I was a young medical student, still being trained. And it's nice to go back there and remember, you know, at the end of the 70s, it wasn't difficult for me to choose what to do because there was not much choice about meditation. You see, I remember reading a scientific article about TM, and so there was kind of a new something, you know, a fashion, you know, at that time. You know, Maharishi Mahesh Yogi had come and started teaching transcendental meditation to everyone in North America, but very early, scientists wanted to see the validity of this. So there was this article there, and I must say I was pretty exhausted. My medical training, I was being trained as an obstetrician, having to do deliveries and babies and, day and night, 24/7, and being on call and lots of work. And at some point, I thought, I was overworked and a bit stressed out about all of this, and I wanted to ensure my success in my study and my career and everything. And I look at this scientific article. I remember being on call and I was waiting for a delivery, and I picked this, this article in a medical journal, quite renowned medical journal, and it said, there's this technique, meditation, and it gives you. Some studies were done about the oxygen consumption during sleep. When you sleep, your oxygen consumption will drop about 10% or something like that, 7 or 8%, I think, normal. During TM, they said, you close your eyes and it drops, to about 16, 17% right away. And it's equivalent to several hours of sleep. I needed that. So I said, that should be good for me. And some more rest, some more energy after that. So I went and took the training, and I must say that was a revelation to me, the training. I mean, when they actually gave the teacher, the TM teacher gave me the mantra, and he told me how to use and everything, and we had this training, Anna-Marie can give us more information about how it's done, but it has to be done by a certified teacher. And very quickly, I closed my eyes and I started. That was my first time, just a few seconds into the practice. It's like cutting the cable of an elevator. I just went down to this silence, restful place that I never knew it existed, never had. I was 24, 25 years old, so I had some experience in life and never knew that that was possible. So I immediately felt the super powerful effect on my capacity of even concentration, capacity of learning, memory, and everything, and more energy, being able to rest, better sleep, and all of this. So that was nice. That I kept going, but being a scientist, then, the years went by, and then you always ask, what would be my life without TM? And you say, I had success and more energy, more everything. And then eventually you say, it should be because I'm good, it's me, something like this. But then this is where I decided to follow the scientific research, because research on meditation at large, and TM particularly, became very more defined, more popular. And then I kept reading about it, and then I could find a scientific research that was matching all of my experiences and all of these improvements I was feeling. So I got very motivated that keep going in my practice, and also in checking the scientific research. So today we're gonna be, I'll take you to some kind of a little strip story about, especially on cardiac health, but there is so much other. I'll have the opportunity, maybe if Anne-Marie decide to invite me, we can later do some other research about the brain, and all of these effect on the TM on the brain is very, very interesting and powerful. But you see, TM is thought as being a technique that gets rid of the stress. It's good for stress, because we do accumulate these stress and kind of take us toward burnout or something during work, or all sorts of problems that modern life can bring to us. And it's thought as being a strong stress relieving technique. And cardiovascular disease it's now very well understood, that it's an accumulation of stress. It's a lifetime accumulation. Lifetime is not so long sometimes. Sometimes it's only 20 years accumulation of stress, and then blood pressure will go up and some other symptoms will happen. Cholesterol will be out of balance and some other things. So all due to accumulation of stress. So if TM is so good to alleviate stress, it should be good for heart health. And actually it is. That's the proof of it. And I like to just take you to this history. The big recognition of TM as being the unique meditation that can be so powerful for cardiac health came out in 2016. So we're just good. But then this publication in 2016 did not come out of the blue. There were many very nice studies that preceded this and came out with this conclusion. So I'll take you to this trip quite quickly, but even for me as a physician and a scientist, I was still wondering how can it be so powerful? How can a mental technique so easy, so natural that you can do like anywhere on the bus or you're waiting in somewhere for a train to come or for an appointment in the physician appointment, and then you can just close your eyes and it's very easy. Of course, you don't do it while you're driving your car. It's not recommended. But how can a mental technique be so powerful to the body? Okay, so that's this kind of mind-body connection that nobody could really explain. And the final explanation of this came out only very recently in 2020. And then again in 2023, another study came out to explain the depth of the effect of this mental technique on the mind and body and everything. So I'll take you to there. Because even for me, that was quite an interesting discovery. Finally, it's like the closure of all my research and my practice, where I was, you always want to have some proof that you're not imagining things and things like this. So science is this possibility of actually bringing some explanation and proof to the effect. So I'll take you to there. So we'll start with some slides. I guess you got the slides? Yeah, okay. See, yeah, transcendental meditation, unique benefit. Unique, it's because I told you already, this is this report in 2016 that came out and you see that, 2013, I forgot. It was not 2016. 2013, it came out, American Heart Association. The American Heart Association put together a committee of experts, cardiologists and medical experts, researcher experts, and all of these very knowledgeable people. They wanted to know, apart from medication, what can we do to prevent or treat cardiovascular disease? Apart from medication, then they found that meditation is very good. So that's a good conclusion. So they came out to the conclusion. There were some other aspects they looked at also, exercise, diet. There are some good aspects. Of course, exercise and diet are also very good. But meditation, nobody was expecting that so much. They came out with this conclusion. Transcendental meditation is the only meditation practice, because they looked at them all, some other techniques. As I said, when I started my own journey about meditation, that was easy because TM was the only one. Now there are so many techniques, so many things you can do. other meditations are good, you know, because I've been checking also the research on them. They have all their own advantage, but not so much as the profundity and the efficacy and the lasting effect that you see with TM. Anyway, you'll see. So it says also other conclusion. Transcendental meditation practice is associated with a substantially reduced rate of death, heart attack, and stroke. That was a big surprise because the original aim of this committee was to find out about high blood pressure, because high blood pressure is such a common problem, healthcare problem that leads to heart disease and other things. So they were surprised to find that on top of reducing the high blood pressure, reduced rate of death, heart attack, stroke, to the point that they said, you know, alternative treatment that include TM technique are recommended for in treatment plans of individual with blood pressure greater than the normal, you know, 120 over 80. Anyway, the level of evidence and their recommendation was 2B. What does it mean? It means that in science, in recommendations, usually the level 1 is when there is a lot of randomized control trials, very, very big studies and meta-analysis of, they call it meta-analysis of randomized control trial. Then it's like, you must do this. When it's level 2, you could do it, you should do, or you could consider it. So that's because studies about TMs, they're not huge. You know, I'll show some of them, you know. In order to be level 1, you need studies on many, many thousands of people compared to, you know, with the treatment, it costs millions of bucks and everything. So the TM is you know, still is in the poverty, you know, there's no financing, it's difficult to find and everything, but it's getting much, much better now that it's being recognized as a positive, but there is no, it's not like a pill, you know, like the pills, you know, you have the big pharmacy back them up, and so they can make very big studies. So TM still needs some more financing to make it bigger, to make it level 1. But still, you know, level 2 is very good. And it's the only actually meditation technique that does this. And there was an interview done with the president of this policy statement from the American Heart Association, the Dr. Brook. You know, he says that's a quote from him being interviewed. TM stood alone among all the meditation technique because of the great deal of research and corroborative evidence. There were far more studies in relation to blood pressure and hypertension on TM compared to other meditation techniques. So I just want to stress one thing. He says, a great deal of standalone of a great deal of research and corroborative evidence, because there was not only evidence about I think they were very nice, very wise, you know, and in not looking only at high blood pressure, they looked at the bigger picture. And it's when you look at the bigger picture that you find how great it is. So they were good, you know, at looking at this. This is what I've been doing myself also always, you know, you cannot shrink it down to one little topic, you know, you just look at the broader topic, and then you see that you can connect the dots and then find out that it's much better than even it shows. So anyway, these corroborative evidence we're going to be looking at also. That's one of the reasons why I bring this up. Today, we are not going to learn to how you practice TM, because it has to be taught by a certified teacher, and I'm not a teacher of TM. And then it takes a little more than 90, 50 minutes or something like this to learn TM. But I can just explain just in a few words, because very often they even use this analogy 40 years ago when I started my own journey with TM. The mind, the thinking process, you can compare it to a lake or an ocean. You see, you have your thoughts. The thoughts are like the waves on the surface of the ocean. And the surface of the ocean is always busy. You can never stop your mind from going. And this is natural. There is always wave there. It's wavy, and there is always activities of the mind. But then in the ocean, there is this activity on the top. But if you go down at the bottom, it's very quiet and silence. And even if there is a storm at the top, it's very quiet at the bottom. And you see, this experience I had very clearly at the very beginning, the first time I started the practice, that I never realized that it could be so silent. So it's called transcending, actually, and it's done in an effortless way by using a sound that doesn't have any meaning. So then the mind cannot grasp it. So it follows the natural tendency of the mind to go for more happiness, more silence, more comfort that you don't know is there before you start. And I remember when they gave me the technique and I started using it, after about a minute or two, there was a car on the street that used the horn. This gave a little bit of a disturbance, and I just came out, and I was not very happy of being disturbed like this. But then after some time, you learn not to be disturbed by the sound, the outside sounds, and you can pretty much enjoy it anywhere. So that's very nice. It doesn't take very much time. So it says that actually you follow a thought down to its source. It's a most peaceful level of the mind. It's at the source of thought. And this is unique to TM. No other meditation that I have studied or even tried, because I was interested in trying different things, it will give you this. No, none at all. Actually, other meditations, they are more involved at watching the waves on top. Many other kind of meditation, they want to concentrate on something or contemplate. They are contemplation techniques or concentration techniques. Concentration technique is that you take a thought or something or an image and you fix it in your mind. So you fix a wave, kind of, but you never go down. You fix the wave. And then some contemplation techniques, they tell you to watch the thoughts. They come and go. So it has its own advantage, but you never transcend by doing this. And I think, and I am sure from all the scientific studies that I've looked at, that it's the transcending that makes the difference. So anyway, transcending is practicing TM. When you practice TM, and I told you about these very nice brain imaging techniques that show us what's happening during the practice. During the practice of TM, because you go deep into the silence of the mind, it leads to a unique experience of restful alertness. That was described 40 years ago when in this little scientific article I told you about, they said, you know, they didn't have brain imaging, but they had measure oxygen consumption in the brain and oxygen consumption of the body, and they saw a difference. There were more oxygen consumption to the brain and less to the body. But anyway, now we have these brain imaging, and brain imaging, you see, in brain imaging, when it's red, you have more blood flow to the brain when it's red, and when it's blue, you have less. So the upper part of the brain, which is the thinking brain, has more blood flow, more activity, especially in the frontal cortex, which is very important to decision making and moral reasoning and everything else anyway. So I won't spend too much time on this, but that is very powerful to put you in a success track in your life. But you see, the lower part of the brain is the automatic pilot of your brain. It drives your breathing rate, your blood pressure, your temperature, your digestion, your hormone level, all of these things that you never have to think about it. They're automatic. They're there. It's the process of your equilibrium of the body. And you see it's blue there. This means that there is a profound rest of the body while there is more activity to the brain. Many different kind of meditation will give different kind of acceleration of activity of the thinking brain, but none of them will give this blue part here, the deep rest of the body. And that makes the big difference for cardiovascular health also. So we'll see how it goes. Okay. Here, I just want to give you a quick real life experience of restful alertness. Okay. What does it mean, you know, when you practice TM and, you know, you have this restful alert, what's going to happen to you? Okay. So this is a study that was published in 2004 and 2003. Reduce high blood pressure among high school students. You see, this is about cardiovascular also. But in the US, especially, there is an epidemic of high blood pressure in young students, especially the Black population. So it's really, people are very worried about this, because if you start having high blood pressure when you're 18, you know, what is it going to be when you're 40, 45? So, and then starting medication for all life, you know, it's a bit of a big deal also. So they tested TM, you know, for that. So they took a group of students, taught them TM, and another group of students not practicing TM, same school, same class, comparable group of people. So anyway, after that was after 4 months, 4 months of practice, but even 2 months anyway, blood pressure started to be lower right away. But you know, after 4 months, they saw a very clear big difference between the two groups. Group practicing TM at a much lower blood pressure over 4 months. But then what was funny, after 4 months, there was no more, the study was over. So they were practicing TM in class. But after 4 months, study was over. They had to practice TM at home or whatever they like, you know. But so we're not even sure if how many of them kept practicing. But they just went back 4 months later and checked the blood pressure again. It remained low with the practicing TM, and it remained high with the other group. Anyway, so that's an interesting example of the restful state. The body, when you send your body to this very, very deep rest, as I told you at the beginning, even for me as a medical student, I had this experience. The body remembers it and it stays quiet, more rest, stress are dissolved even after the meditation, and the blood pressure stays low. But what they did is that the same group, the same population, they also checked how they were doing in school. And the same population show a beneficial impact on TM of absenteeism, rule infraction, and suspension rate. All of a sudden, these students, by practicing TM, they became better students. They were more able to realize the long-term advantage of going to school instead of, doing something else. And rule infraction, follow the rules. You see, in a word or two, they became better person. And I don't know of any technique, mental technique so simple that can change a person into a better person. Even if you tell somebody to be better, to do more compassionate, to be blah, 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 something that the preachers have preached for so many thousands of years, and I'm not sure we haven't seen much of the difference, but there is a lot of research about TM, a lot of research showing that it actually creates a better person. Decision making is more clear. You feel like you want to do good. You want to be good for yourself. You want to be good for, like, drug addicts, stop taking drugs, smokers don't smoke anymore, drinkers, lots of things, But anyway, so this is an example of restful. Blood pressure goes down, alertness, better brain, thinking brain. Okay, you understood. How does it happen? It happened because of brain plasticity. Brain plasticity, it refers to the brain being able to modify its structural organization depending on living experience. And I'll show you a slide at the end. What difference does it make, this living experience? If you have bad experience, trauma, lots of stress, too much tired, and you have to do too much and you're overwhelmed and everything, the brain will go into survival mode. Here it says survival mode. It's called allostasis in medicine. And then when it does this, the brain changes itself to protect itself. Actually, it's an adaptive mechanism to protect yourself because you're under threat. So brain will go in survival, but it's going to be done at the cost of development. Then you close your thinking process to very narrow, and then anyway, you understand. And this accumulation of stress, it's called, medically speaking, it's called the allostatic load. It's the stress that you just build up all the time. And then eventually the thinking become confused and you make mistakes. Your life can go very bad, and it's very subtle. You don't see it coming, but mental and physical health can be disturbed. So the science, we know how to measure the allostatic load. If you can take someone and then say how much stress you have accumulated in your system. And the way it works is that this is all about cortisol. Cortisol is the stress hormone. You see here, when you have a stress, you're under some kind of a stress or tension. This is the red arrow here. Then in order to respond to the stress, you're gonna bring your cortisol level up, respond to the stress, and hopefully, because of resilience, your cortisol should go down to the baseline after the stress. But modern life is so constantly into fight or flight or all of these things that eventually the system is not able to bring your cortisol down after a big stress. You stay up a little bit, then you have another big stress, and then you stay up. Then in survival mode, you have cortisol is higher. And then when you have a stress, you're not able to respond to the stress. Your ability to face it, to properly deal with the situation is weakened and weakened, okay? Because cortisol, there's a certain amount you can produce, and then you're top already. So when you're in chronic stress, cortisol level is higher, and then when you need it, it's not there to help you, basically, okay? So that's very well demonstrated here. Physiologic indicator of allostatic load. Just very briefly, blood pressure, cholesterol, glycosylated hemoglobin is an indicator of diabetes. Then cortisol, norepinephrine, epinephrine they are three stress hormone. And then you have the dehydroepiandrosterone sulfate, DHEA. This is a hormone from the surrenal gland that is an indicator of longevity, okay, longevity. When the DHEA diminish in your blood, then your longevity, it will be curtailed, okay? It's like we are born with high level of DHEA, and then it goes down. TM has shown many studies, but I'll show you a few to influence all of these things. Lowering blood pressure, lowering cholesterol, lowering the diabetes, stress hormone, and increasing the DHEA. So that was shown about 20 years ago, or 20 in the 1995. Somebody did a study about the DHEA and found that TM's practitioner usually have the DHEA 10 years younger than the non-TM practitioner. They are biologically 10 years younger. That's kind of impressive, but you see it was you will see it was shown in other studies. It's not the only one. These are the corroborative study I told you about. Finally, when you practice TM, you're better off. That's we call it the homeostatic cortisol baseline. Cortisol is lower. There are two studies that have shown this on young student, they were in university, and a group was practicing TM, another group was just struggling to university like we all used to do before TM. Anyway, so that was what they discovered is that their cortisol level was lower to start with. But then if you submit them to pain, it's a pain during a laboratory, and it's a research thing. So then this physiology consider that as a threat. Then the non-practicing TM, they have a higher cortisol rate, but if you submit them to the same pain, they barely can. So what it means is that your life is more quiet, restful, nice. But if you need, because let's say you have to, you like sport, or you do, or you have no choice, you have to face some difficulties or a tough exam or whatever, your cortisol level will be able to take you through this and face it and be able to face it better. And then after this episode of stress, resilience will bring it down to its normal level. So TM practitioners have more resilience. They're much more resilient. And this is my experience also. As I told you, I had some very practical experience, because in my field, we have to answer difficult situation and emergencies. And as a surgeon, I have to be able to make decisions in a flash. because they're life-threatening and everything. And my experience is, even if I compare myself to some of my colleagues, my experience was very good about this. So that's, anyway, so another, that's another, to show you another study instead of talking about me. But you see, the first study that was very attracted everyone was in 1989. That's a while ago. This Alexander, went into an elderly hospital, elderly place, where they have all these elders, and they have mean age of 81 years old. So they taught them TM, and then there was 3 groups. The TM group, and then the other group was practicing as mental watching of the wave. I told you at the beginning, they were just having some exercise, just to make sure that they have a cognitive exercise to do. The third group were the usual care. No special treatment. They were just there in the institution. Anyway, after 3 years, 100% of the TM group, they were still alive. Control group, 76%, so 25% difference, 24% difference between the two. And then the poor other, that they didn't do anything, 63% were still alive. So that was quite impressive, that longevity. First time they were doing something about longevity. You remember the DHEA? That's triggered these studies about DHEA, because they said it must be increasing this DHEA so you live longer or something like that. So then they kept going after 15 years. So they came back 15, they followed up for 15 years. Their cardiovascular survival was 12 years, 0.3 for the TM group. And the other group was, they still have this 25% survival rate, just because they were closing their eyes. How many times? For 15 years, some were probably doing still. I think they even studied the one that they kept being regular, and the one that were not so regular, the regular one had the best results. Anyway, so survival rate it's quite a in 1989, you says, how come you just close your eyes and you do this little mental technique, and then it gives you 25% bonus of your lifespan, even when you're 81. So that's not, imagine when you start young. I think I should live to 120 or something like this. Anyway, so so I'm just taking you through the story, what happened, how did the American Heart Association came to the conclusion that, wow, there is something there. They had this group of cardiac patients. They had coronary angina, they had angina, and so they taught them the TM techniques, and the TM technique, and I think it was after a year of practice, the TM practitioner, they could exercise their heart, even they had heart disease, but they had increased their exercise duration by about 15%. The maximum workload they could do with their heart was very much, and then the onset of angina was much less. And compared to look at the other groups, they had not changed much, over the period of a year. So in only 1 year, their heart was working about 20% better. And then they have 20% less. They could do more exercise before they had to stop. Anyway, so that was also very surprising because pills don't do this. And these patients, they were already on medication and pills and treatment for what the problem they had. So TM would just give them that over and above, disadvantage. But then the big one was this one, because from this study, they said, oh, maybe we should take a look closely about TM, what it does for cardiac disease. So actually, very quickly here, they found that they were measuring arteriosclerosis, the thickening of the artery walls. When arteriosclerosis is that the wall of the artery become thicker, and eventually blocks because it's swollen. It's thicker on both sides. So eventually it can block the circulation. So, and it's, of course, not suitable. So what they found is that after 7 months of practice, TM, number of patients, 60, 7 months of practice, they compared to the group that were not practicing TM, this swelling had increased, over the 7 months. It's just getting worse. And with the TM group, it has reduced very significantly. The difference between these two groups is just huge. So then it became, so that's another of these corroborative, evidence. How can a small mental technique can actually reduce the physical thickness of the, and I'll tell you at the end, because the answer to that just came in 2023. Okay, so keep going on this. This is another study that, because everybody was now very interested in keep going at how it works and what's happening. In 2006, a randomized controlled trial, one of these best studies that were done, controlling two groups and being sure that the effect is really the intervention, which is TM, and other intervention is like all the pills and everything that you take for these problems. And then the TM group were on the pills, but they had TM. Randomized control, 103 subject practiced TM for 4 months, only 4 months, okay? Improved systolic blood pressure and improved insulin resistance. That was the first time ever that a mental technique was so efficient for diabetes. Insulin resistance is type 2 diabetes. So that was another discovery, and that's why I'm taking you to this allostatic load, that reduce. And the main researcher that was driving, these are cardiologists, specialists, and independent, they choose to test TM. And he said during an interview, TM technique is the only technique that has been studied the most, the one technique that has been studied the most and the most rigorously in randomized controlled trial. So randomized controlled trial will lead to a level 1 recommendation, but we don't have enough, but it's getting there. And the most rigorously in randomized controlled trial, we choose TM because it's highly protocolized. We choose TM because it's standardized, whereas many other are not standardized as much. For instance, TM is trademark and you have to be a certified teacher to teach it. We select because TM, because there were other good study about it. But you see, they picked it up because it is very standardized, it is very systematic, and it's always done by a certified teacher. You see, if you learn TM today, you will learn exactly the same technique that I have learned at the end 40 years ago. Okay, so that's reassuring. And it's all other meditation techniques that are new. They have changed over time, and it's very difficult now to make sure that what you get something, but you cannot rely on studies done 10 years ago because that was maybe a bit different, taught differently, I mean. So anyway, so that's reassuring because all of this can apply to anyone, learning TM anywhere in the world now. So the icing of the cake, it came in 2012 actually, because they did the 202 subjects were followed for about 10 years. They were having some mild cardiovascular problems, high blood pressure, some little things like this. But then they taught TM to a group, and then the other group had health education. And then the big surprise was cardiovascular mortality, myocardial infarction, and stroke were reduced by 48% in the group practicing TM. And also, just big surprise, as Anna-Marie said at the beginning, all-cause mortality was reduced by 40%. So anyway, so they lived longer, okay? 49% for cancer. So even how can a small mental technique give such an impressive bonus on your health without changing much of anything else? Life expectancy was improved by 23%. You see, that's at the beginning. You see the 1989 study gave this 25% bonus. It's still there for this group. So it seemed to be consistently giving it. Just to tell you, in comparison, antihypertensive drug and other drugs for cholesterol and everything, other drug, it reduced the cardiovascular risk by 25 to 30%. Cardiovascular risk is reduced by 25 to 30% with medication. These groups, the two groups, they were on medication, both followed by physician and everything. TM just gave this extra on the TM group at these results. So that led to the policy statement of our American Association. I thought it was nice to take you through this, how they came to this conclusion. They did not come to this conclusion by chance. They just looked at the evidence-based medicine, actually. So this is nice. But then you may say cardiovascular, maybe I'm not at risk of cardiovascular disease. I have bad news for you. We are all at risk because we keep accumulating these stresses and the stress allostatic load. And then eventually this allostatic load will just be too heavy on your physiology, and then you get sick somehow. So anyway, I just want to give you this example of another research that's 1996, looked at a group of people, started TM, and then this other group, they followed by a similar group that did not practice TM. And what happened is that the TM group, that's the one with the kind of pale line here, they had a 13% decline in medical expense every year and 55% cumulative decline over a 6-year period. So when you start TM, all of a sudden, there's so much of a rest in the system that whatever you are, whatever is your situation now, you'll end up better. I mean, it's not the same for everyone, depends on your age and if you have already problems, but you always make a better deal because you just release this allostatic load. Anyway, so that's overall, not only for cardiovascular. So I come to my final conclusion. Hopefully we're a bit late, but how to explain this profound effect on health and longevity? You have some explanation already that it reduces the allostatic load, but it's all physical. But how does the mind come to this physical result? Okay, so this is the big question we can ask. And so I'll give you the answer right in one word: epigenetic. Epigenetic, it refers to the process, any process or experience that will alter the gene expression without changing the DNA sequence. Okay, we're all born with a gene, with our genes from our parents. We always thought, you know, that we're a bit stuck with this genetic transfer, but now it's not true anymore. Epigenetic is a big field of research. Actually, every experience you have can actually be transferred. It's like the DNA is sensitive to the experience we have. And then it's being epigenetic. It's like, just to explain, it's like a dimmer switch. The DNA is the same. You don't change your DNA. But it's like putting a dimmer switch on your DNA, and some genes will be upregulated, meaning they'll be increased, and some will be downregulated, meaning their effect will be decreased. And the problem is that when you have lots of stress, allostatic load, your bad genes get upregulated, and your good genes protecting you against infection and everything, unfortunately, sometimes are downregulated. And then the whole physiology goes the wrong way, okay? So it's called brain plasticity. It's the brain answer to that, because DNA takes care of the reproduction of the cells and then the whole physiology. And it refers to the capacity of the brain to modify its structural organization depending on living experience. This will influence our physical and mental health. It's all about this. And just quickly, I just told you about this. We think we inherit from our parents, and that's all. No, it's not true. The environment, experience of repeated stress will badly influence our epigenetic. Our brain plasticity will send our physical and mental health in the wrong direction, and then even the behavior. I told you about you understand now why the student, they become better student, because their brain is more connected. Instead of making a decision with only this little part of the brain, before I make a decision in the morning, if I go to school or if I prefer to just go to with my friends and run my bike in the city, and I don't care about school. Two decisions. But before I make a decision, when I practice TM, I have this, should I go to school or should I go with my bike? And then the brain will just computerize it better and say, you better go to school. Okay, so, and it's spontaneous. You don't realize. Kids are better. The student, they do better. Your physician would be nicer if he's practicing TM. And then everything is so smooth. Okay, you don't end up making mistake so often. I'm not saying you never do, but sometimes I think when you practice TM, you think you did a mistake, but then a week or two after you realize that finally that was a good one. So don't make conclusion too early. So anyway, so that's why TM will bring this restful alertness, which is a very unique experience. And then the epigenetic will just answer this. Brain plasticity will improve your physical, mental health, and behavior. So you understood the way it works. Now, what are the evidence that this is true, that it doesn't? Okay, because I just told you some kind of a theory. But what are the evidence? There are two research that were published recently, actually 2021. TM practice, evidence for prevention and reversal of stress effect harmful to health. Okay, that's you have the name of the article here, but okay. So what happened is that they took long-term TM practitioner, people a bit like me, I guess, but I wasn't in this study, but you know, they took long-term. You see, in many other meditation practice, it's difficult to find long-term practitioners because they quit sometime or because, but it's easy to find long-term TM practitioner because they are compelled to keep going because they feel so good. Okay, so 23 long-term TM practitioners were compared to 22 controls that were not practicing TM, but they were healthy. They were comparable. They weren't sick or anything like this. Median age 65. So so they identify 16,000 genes, but they identify 16,000 genes on both sides, but 200 were very different, significant change TM compared to control, okay? 136 were downregulated and 64 were upregulated. This is the dimmer switch, huh? I told you. So you see here on this graph, but I mean, you see there are 200 little lines here, and then there's all of these very stuff that only the researchers can really find out exactly, but you see the difference. You see you have the meditation here. You see the upgraded are red. When it's red, it's up. When it's green, it's down. You see all the red here, they were up and now they're down and controlled before. And then these were down, now they're up. You see, this is the difference they have between the two. Now, I won't make it too complicated, but you will understand. The one that were upregulated, they were 13 defense response genes, meaning that immunity was improved, protect you against disease, protect against bacteria, virus, better immunity, kind of upregulated. The downregulated, 35 were stress response genes. So they were genes that encourage stress, you know. 64 cardiovascular disease gene. Now you have the answer for all the research I told you before. 6 genes were inhibiting energy efficiency. This is aging. There is a little battery into every cells, the mitochondria. They produce energy for the cell. It's like they produce energy for the cell. And over time, cells become weak because there are less energy there at the level of the cells. And so 6 genes that inhibit the production of energy in the cells were downregulated. So please keep quiet these genes and let my cell be more energetic. Huh? And one about longevity. So you see in this slide, you have the whole answer, and it's very new. The whole answer about everything I showed you before is that cardiovascular, protected, less disease, more longevity, and everything like this. And then finally, after they found this, they said, oh, there must be something deep about stress in this. And there is a, this study was published. Transcendental Meditation practitioner shows reduced expression of follow me. You don't have to remember this. I even forget it sometimes. Conserve transcriptional response to adversity, CTRA. I prefer to remember only CTRA, but it's nice to understand what it is. It is considered to be the molecular signature of chronic stress. You have to understand it's conserve transcriptional response to adversity. It means when the physiology is exposed to adversity, stress or trauma or anything like that, this CTRA is produced to help you deal with the stress, okay, to increase your cortisol, make sure you can defend yourself or resist this attack or something like this, okay? So, but the problem is it is conserved. It is like the physiological memory of actual or previous threat or challenge that keep going even long after the situation is resolved. The most evident example of that is PTSD, people, the soldier coming back from war. They are stuck into this CTRA, just the memory of everything. And then what they found is that in the population practicing TM, CTRA is reduced expression of the conserve. And CTRA has two characteristics. It activates, and follow me, it activates inflammation at the cellular level, and it deactivates protection against infection. So when you activate your CTRA, you have cellular inflammation, and you're not able to, you're not in good health because your immunity is low, okay? And that is a big discovery for the cardiologist, because you know why? Now the cardiologists, all the specialty in cardiology, they're starting to think that cardiac disease is not due to high blood pressure, cholesterol, diabetes, and everything like this. These are risk factors that will take you there. But the real cause is inflammation. Inflammation at the cellular level. You see this thickening of the wall of the artery, it becomes thicker, and then eventually blocks the artery. It's probably due to inflammation, the swelling. So if you lower the inflammation, you decrease the thickness. This is the study I told you before. TM improve immunity and help the physiology forget past trauma, because it's all due to past trauma. This is why now we have a scientific proof of the capacity of TM of eliminating deep-rooted stress. I've been told this about TM since 40 years, you know, it's very good. It releases stress and everything like this, but how does it work? And what does it do actually, the physiology? Now we've probably discovered the mechanic of it. So that's nice. Now you have the answer, you know everything. The only problem about the study I just showed you is that they were done on long-term TM practitioners. Then you say, do I need to practice TM for 40 years to have this effect? The answer is no, no, no. Unfortunately, they did not have a short-term group of, they took the long-term because they wanted to make sure, it's very expensive to do these tests. And then they wanted to make sure they had something. But I think now they're going to do this. But I just want to show you here that another study that was done during the COVID pandemic, 65 healthcare providers using TM were matched with 65 normal lifestyle. And only after 2 weeks, they had 45% reduction in depression, anxiety, and even insomnia was better. I mean, it does not take 40 years. But you'll see also with these 81 years old, after 3 months, they had 25%. After a year, they had 25% bonus on their longevity. So it's much faster than that. So it's reassuring. You don't need, it's very quick. You know, you get the result very quickly. I am done. Very good. It's going to be a pleasure to answer question. But I think before we go to the question, Anna-Marie, maybe you should explain a little more. What is the action? You know, what should we do now? I think my suggestion would be don't wait for anyone. Don't wait 40 years and then for you to be sick and tired and no. Enjoy your life. Enjoy it, every moment of it with TM. It's very important. So please, Anna-Marie, give us some information about this. I'll stop sharing.
Yeah, thank you so much, Dr. Guy-Paul, for this very fascinating presentation. And myself at the end, that inflammation at the cellular level, like that cells can forget past trauma. I think we all know we carry some backpack of, stress with us. And so the profundity of our TM being able to really allow a cell to forget that trauma and become healthy and resilient again is fascinating. So, yeah, before we open it up to all your questions, you can already put them in the chat or even raise your hand. I just want to briefly share with you, if you feel inspired and would like to learn more about transcendental meditation or start the journey yourself, here's the next step. So to learn more, the first step you will take is just attend a complimentary preparatory session with a certified TM teacher in your area or even online. And during that session, you'll be able to learn if TM is suitable to you and how it applies to your unique situation. So what you learn during that preparatory session is you'll explore the benefits, how TM can help, and what you can expect from learning TM, unpack a little bit more some of those misconceptions about meditation and how it compares to other forms of meditation that you may have tried, and really get an understanding for how you learn TM and the TM course itself. So it prepares you to make an informed decision to see if you want to learn. And at the end of the preparatory session, you are able to talk with a certified TM teacher and discuss your personal consideration and learning TM in more detail. So the best way to find a preparatory session, either at a TM center near you, or some of our centers offer online session too, is to register to our preparatory session. And we'll put it in the chat through our website. And I'll share the link to find your location or what's closest to you. And we actually have until the end of March, even a special friends and family offer available. So once you go to the website, it will give you more details about that special offer if you learn or decide to learn TM until the end of March. So with that, I'd like to open it up to Dr. Guy-Paul and any questions you may have. So if you have questions, feel free to raise your hand. You can come on mute and speak with us, and also put your questions in the chat if you like. And Guy-Paul, we already have one first question. Someone wrote to me, Kim is asking, if I already have low blood pressure, is it okay to do TM? So that's, I think, an excellent question.
Absolutely, yes. No, it won't do. TM will normalize your blood pressure. If for you this is normal to be low, like this is going to be low, but it's not normal when it's high. Don't worry about low blood pressure. I will tell you, really, usually it's a good sign. You're not too much under pressure. Your cardiovascular system is not working too much. So the benefit will be great, and you will not, no, don't worry at all about your blood pressure. It's okay.
That's, great to hear. And Kim says, thank you. So beautiful. And we have someone else asking, who's already practicing TM, Mary, and said she did a sleep study not long after she started practicing. And one of the things that she was told was that her sleep patterns with apnea would eventually affect her heart health. And so she was wondering if TM could help reduce that effect, and because she would rather not do the CPAP machine for sleep apnea. Any recommendations that you have?
Yes, I think it should help, but it's best to follow the recommendation of your physician if they find that, it's like TM for blood pressure. In this report from the American cardiology, they still say, if you have some high blood pressure and you want to start TM instead of pills, go for it. Do it. They say there's nothing wrong in trying. If your blood pressure come back near normal and you never have to take pills, great. But if, it depends on, the amount of stress accumulated and everything. So it's the same thing for your sleeping. There's nothing wrong in trying, but follow the advice of tell your physician that you would like to just keep going with your TM. And then if, after a while they say, well, you're disturbed but then let's follow their advice. But I would have a few general advice about sleep hygiene. Go to bed early, and I mean, there are in during the day, you have these cycles during the day, cycles of hormones, cycles. There are cycles everywhere, cycles of the sun around the earth, and cycle of the moon during we live into cycles. And the best time to go to sleep is it's strange, but it's between 6 o'clock p.m. and 10 o'clock. So make sure you're in bed before 10. 9:30 is probably the best. And then there is another cycle in the morning between 6 and 10 where it's better to exercise. And sometimes people have tendency to go to sleep later, and then they sleep later in the morning into this period of lethargy. There is a period where if you sleep beyond 6 o'clock, you won't, and I was told this when I was very young, okay? And I didn't care about it. I had some other things to do, and you have something to do in the evening, and then blah, blah, blah. But eventually it came up to me, maybe because of my TM, and I said, let's try it. And I'm so happy I did, because you're more energetic during the day. If you're out of bed by 6 in the morning, some people think it's too early, but it depends at what time you go to bed. You need about 7 to 8 hours of sleep. Maybe you do that already. It's not, I'm just giving you it's advised, good for everyone. I mean, you're much more energetic when you rise early in the morning.
Great. Yeah, that's very helpful. Now, if she had a quick follow-up question from Mary, which should I do first, TM or exercise?
You mean for, I
In the
would
morning.
say, why don't you try both? But I think TM, from everything we saw, in the study, and the deep effect on your physiology. Exercise, you're right to ask the question, because exercise has also been shown to give blah, 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 all these reduction of cardiovascular and the reduction of this and this, but you have to do a lot.
Yes, I think she was
TM,
wondering if she does first TM or exercise
oh,
first in the morning.
that's
In
what
like
I
the sequence, what
okay,
would
didn't
be better? Shall we
understand.
exercise first in the morning or
No,
meditate?
it's better to, you have to exercise it best before 10. So you have lots of time to do your TM in the morning and then exercise after. I would do this, sure.
Yeah. And it's actually what we as certified teachers recommend generally to, and you'll learn that during your course too, is that we do more gentle activity like yoga, gentle yoga before our meditation, that's fine, but more exerting exercise, because in TM you're settling in a deep state of rest. More strenuous activity or exercise is better after your TM generally. Yeah. So, and you'll learn more during if you go for even a TM refresher session, you can check in, Mary, too, with the local teacher if you have further question and Dr. Guy-Paul already answered as well. So great. Yeah. Any further questions? Um, oh yeah, I have actually, there's one general one that I think is interesting to a lot of people. What are some of the ways that people may notice the difference in their cardiovascular health once they learn TM? Are there examples you could give how one may feel different
You
or
see,
notice change?
yeah, it's a good question. But you see inflammation at the level of the cells, you will not notice. And then your blood pressure, if you don't take it, you might not see it. But uh, generally speaking, it depends on your age also, but you be more energetic. You have more capacity to do what you want to do and realize, do your work and everything. And so it's not going to be so much at the level of cardiovascular, but maybe generally speaking, your physiology will be more free, more energetic. And then you see, if if you want to do sport, like for example, you want to exercise, you have more reserve. The heart rate will usually go lower. And then if you want to exercise, you have more room to exercise. Like I'll tell you, there are lots of research about TM and sport, and then lots of even anecdotal but very interesting example of champions, that they became when they started TM. They were at this level of their sport, and then they became really very good at it, and it's well described. So more capacity to achieve more energy. So it means that the circulation is better, heart is better. And there was recently I went through this new study. They looked at long-term meditators, and they found that their respiratory rate was lower. Okay, normally you breathe about 16 times a minute or something like this, but then long-term meditators, they have a lower rate of outside of meditation, just like that. You breathe not so often. Then the physiologist says, if your breathing rate is lower, then it means you must be breathing more air every time you breathe. Like they say, the flow, the flow must be compensating for the reduction of rate. They found, no, you don't. It's actually your metabolism is lower. Metabolism is lower. So actually you spend less energy to live your life because you have less stress, cortisol level is lower. So you're not compensating with something else. You're just saving your energy. So then when you need it, it's there. So that's you should notice. And this is also everything else about the brain and capacity to learn and remember and everything. There is lots of advantage of this.
Beautiful. Yeah, really good. Energy, I think actually Jerry Seinfeld said one thing he loves is energy. And that's what he feels his TM is giving him is, that ample amount of energy and vitality, which, yeah, is beautiful. So to close, Dr. Guy-Paul, what is the best way you recommend people to start learning TM? Is there anything
You
you
see,
want to give people?
yeah, the answer is kind of I use my own experience. I use my knowledge in the research and my experience as a physician with having recommended TM to my patient, especially I work with pregnant ladies and everything, and the effect is so beautiful and powerful. Based on this, I would recommend anybody not to wait, just go for it. It's an easy thing. It's not a big deal. And it's the dividend, the effect of it was so powerful, quality of life. And So my advice, as always, to my patient, just go for meditation. It's good for the body and the mind, and it's good for your family. It's good for your friends, because also there is another aspect that we did not speak about, is that the effect of TM on the environment. You know, if you yourself are more relaxed, you have more, we call it brain integration. Your brain is more structured, more in tune with evolution and what you should do. It's also transfer into the environment. And this is also new, but not new about TM, because TM was shown to help, you know, the coherence of the population. And we call this you know, the collective consciousness. Collective consciousness is improved with TM. So that's well demonstrated. But the TM group was the only one pretending this. But now they're studying this all over the place. They say that, you know, a teacher teaches in front of a class, and then his state of consciousness transfer into that, like the student in the class, they sync the brain wave of the teacher will transfer the syncing, the synchrony with the student. So this is new, but now it's a very exciting story. So this is why now it's an explanation. So it's also a new explanation, because from the fact that if you start TM yourself, everybody around you will benefit from it. It's really something special. And if other members of your family start, it's even better, because now it's going to be like an orchestra, like a nice symphony. And it is the explanation why apparently we never learn really from a book. We read into a book, but somebody has to speak to us about this. This is why teachers are so important, and we learn a lot. And this is why also we have to learn TM from a teacher. I wondered, you know, for many years, why we could not learn the TM on a book, you know, or sometime. And they kept saying, you know, the teachers, you know, you have to learn one-to-one from a teacher. But now I realize, now there is some evidence that it's the exchange of knowledge. You learn from consciousness to consciousness. You don't, otherwise, if you read a book, you read it in a book. Let's say, for example, you read in a book that you should be nice and you should be blah, blah, blah. This is a good book, you know, explaining to you all the good qualities of life and everything. Then when it's time to act, it's not going to be with you. It's in the book. It's there in the book. It doesn't transfer to you. But if you speak with somebody very wise, and he tells you, and this is why you have to keep the company of the wise people, because they transfer to you their wisdom. And if you start TM, you become the wise in the group. This is the way it works.
Yeah, wow, that's so beautiful, so beautiful note for us to end on. And just a personal story, there's actually someone who shared who learned TM in the 90s when he was 20, and he stopped in between and actually saw his doctor because of high blood pressure, which was 145/96. And his doctor was quite concerned, asked him to relax, and it dropped a little. But then he started doing his TM technique, and his doctor measured twice, and it dropped to 110/72. So he says hi and says he's very inspired and has to get back to his TM practice. And once you learn TM, if we find your TM course record, you can get a refresher that's really part of your ongoing and lifelong support system. So once you learn, you really have that support for life. So please reach out to us. You can email us through our website, and I'll just share my email with the person too for further follow-up to verify the TM course. And for everyone else, we'd love to share more with you, hear your personal story, your interest, so you can join us at a preparatory session. I'm in Vancouver. My colleague Eric, who's connected too, he's in Montreal, and we have wonderful teachers across Canada. So even if you live a little further away from a TM center, you can find a center in your region, and they offer sometimes online session, or just reach out to the center so that you can get in touch with a teacher to help you answer any question and start your journey if you're interested. Because the learning process, as Dr. Guy-Paul Gagné said, it's the first day that we learn is always one-on-one, so that you really learn in your pace, with your pace, and really get that effortlessness and simplicity of the TM technique too. It really becomes second nature. That's why we say it's a simple, natural, and effortless technique. So it's a beautiful way to just have that nourishment for your whole body and heart and health every day. And thank you, Dr. Guy-Paul, for being with us, for sharing your just incredible depth of scientific knowledge and making it yet so accessible and personal. So we hope to have you back for many more sessions. And any closing remarks, please share with us before we close.
Don't wait, start here and enjoy the rest of your life. Enjoy. You don't realize before you start, that was my experience also, what you're missing. It's very difficult. It's an experience that we don't have spontaneously. You know, we have to be taught this technique. So enjoy.
Beautiful. Thank you.